With this machine here, I'm going to be doing a total facial and microdermabrasion. So it's going to include not only microdermabrasion, but also masks and other exfoliants that you can use with it. I want to make sure that I use a cleanser that is a sudsy cleanser, a foaming cleanser, not a cream cleanser. And the reason you don't want a cream cleanser is because it will leave a film on the skin, and that can clog up your machine. I want something that's going to be a mild degreaser for the skin so that I remove all the excess oils from her skin too before we start the microdermabrasion. And so with this one here, it's a nice foamy cleanser, not leaving any film. I did add a little bit of water with the cleanser, but you wouldn't need to when you first applied it. And you always want to make sure the skin's thoroughly cleansed, so I'm going to do 2 cleanses on her. If there's any makeup or other products such as moisturizers or sunscreens on the skin, it also can clog up your machine. So you want to make sure the skin's thoroughly cleansed. She's got really nice skin. As I'm cleansing, I'm also analyzing the skin. Where's any rough texture of her skin? Where's any congestion in the skin? Also analyzing her skin for any broken capillaries. If she has broken capillaries on her skin, we may want to turn our suction down in that area. You look for any rosacea, the chronic redness into the skin. Look for any blackheads over that area. We could actually work the skin a little bit more in those areas. Now after I've cleansed, I'm going to be using an enzyme on her. The enzyme, we're going to use about a tablespoon of this enzyme. We're going to mix it in with some water and apply some steam to it to activate the enzymes. And then with our mask brush, apply the enzyme onto her face. Nice light coating. This is going to help to soften the dead skin cells, digest some of them before we actually get in there with the microdermabrasion to abrade the skin. I like to go right into the nasal foci, that depressed area of the nose. Usually have a lot of microcomedones in that area, and you can do the upper lip. And then we apply our steam onto the face. Enzymes are always activated by heat and by especially moist heat. Starts working them, so they do that little Pac-Man thing. We'll want to leave that on about 5 to 10 minutes. And then we remove it. I like to use a nice hot warm towel. Also, I like to use soft dermal towels versus your terry towels anytime you're doing microdermabrasion because they're not as abrasive with the skin. You want to use something that's softer. If I'm not using a dermal towel, I'll use a 4x4 gauze. Also nice. And a lot of estheticians will use those instead. They call them aesthetic wipes. You always want to make sure you've thoroughly removed all of that enzyme because enzymes will continue working. So if you don't remove it all, it will keep digesting away at the dead skin cells. And then I want to make sure that the skin is nice and dry before I start the microdermabrasion. After you've cleansed, there's water on the skin. If I use my microdermabrasion with moisture on the skin, it can clog up your machines. You get too much moisture there and it doesn't abrade as well. So I just take a dermal towel and just kind of dry the area and just feel for any moisture. It's feeling dry. And then we have our machine. With this machine, it has disposable tips. Not only does it have disposable tips, it has different grids. If I'm dealing with somebody who has got like acne scars or thickened sun damaged skin, I might use the coarser of the head. One's red, one's blue. The blue is coarser, the red is finer. And on Nicole, I think I'm going to use the finer one. Your tip just slides right on in. What's nice about this machine here, it also has an LED light attached to it. And the LED light helps to actually heal and stimulate collagen within the skin. And I'm going to start working on my pattern, on my grid. I'm going to start in the glabella area right in between her eyes first and working just in an upward stroke away from the nose, creating like a little fan. Now I'm going to go in with the vertical lines. I'm going to come from the center of the forehead out to the temple. And I use a very light touch. I allow the skin to come up to the tool versus me scraping it across. You have to keep your tool at a 90-degree angle from the skin or else it jumps off. Now I'm going to come from the eyebrow up to the hairline, finishing my grid. And remember, the face is round. It's not a square, it's not flat. Keeping the tool at a 90-degree angle all the time that you're coming across is really, really important, or else you're going to hop, skip, and jump it across the face. You're going to see a little bit of redness in the skin. That's normal, but that redness shouldn't last but just a few minutes, and it should subside. Now, if I'm working on scar tissue, I may want the redness to stay there a little bit longer. I just want to stimulate the blood flow, so it'll stimulate the fibroblasts, which will produce more collagen and elastin. Now coming up, and I hold the skin lightly. You don't want to hold it too tight because you actually want the skin going up inside that hole. The tip itself has a little filter in it, and that filter is catching any of the dead skin that was coming off of it, and oh, her skin is feeling smooth. We could do 2 passes with this, and as a matter of fact, I'm going to do that with her. So we do 1 grid, then we're going to do a 2nd grid. If she had acne scarred skin, I may do 3 grids, and even up to 4 grids, depending upon how thick that skin is or how scarred that skin is. You want to keep a nice even speed when you're working with this. Don't go too slow, or else you're going to leave hickeys. Don't go too fast, or else you don't abrade enough. I want to come up underneath that where they get a lot of stress outbreak. So if she's got a real sharp jawline and I have a hard time coming all the way across the jaw, I'm going to come right to the point of the jaw, and then from the point of the jaw to the ear. If you feel like you have good control of your wand, then you go from the tip of the chin all the way to the ear. But when you first start, that might be a little bit more difficult. Making sure I keep this at a 90-degree angle. Also, when you release it, you don't release it coming straight up because you're going to create a hickey. So when I release it, I actually turn my wand down, and that releases it gently so you don't give her a hickey. And again, I'm holding the skin lightly, not too taut. Now I'll go to the other side. And on this side, I may not feel like I have as much control, so I just go to the sharp edge of that jawline, and then from the edge of the jawline on across. And then down. I'm going to have you pull your lips in lightly, and we're going to do the chin. And on the chin, we're going to come across it. Now I go to the cheeks, and on the cheeks, we're going to come down from the orbital bone down to the jawline, and then from the nose out towards the ears. Turn the head to the side. As you come closer to the orbit of the eye, you may need to hold the skin, especially on more mature clients. So if you need to hold the skin, just taking your pinky, lightly holding it up. You know, if you have a client who's got really lax skin, maybe a more mature client who has like a Glow-Gal 4 type skin where their skin wrinkles really easy, you may even need to hold it a little bit firmer. So now we're going to come across horizontally, and I seem to be losing control as I round around by the ear. So I'm only going to do half, from the lips to the side of the face, and then from the side to the ear. But you can take this right up to that eye line. Remember where our tool is here. So when it looks like I'm going right onto her eye, the tool is here, the light is just coming up. So I'm really coming right up into that orbital area, right up next to the lash line, which is really nice. And then the side. What's nice about this microdermabrasion, there's no crystals, so you don't have a lot of crystals falling into the ears, falling all into her hair, getting into her eyes and her nose. Come on to the other side, same thing, coming down. And you want to watch. If you notice any little pediculi, little tiny blood specks, then you stop. You don't keep going. That means that the skin is too thin for this, okay? And now I want to go into the temple areas. When you're working in the temple area, right into here close to the eye, I always start at the hairline and work in towards the eye. The eye's really sensitive. So I'm going to start the hairline, coming in now close to her eye. I watch her body language, because if it gets too sensitive, she may jerk a little bit, then I know that it's too much and I back off, because you can get right into those crow's feet. And you can see where that little redness is right into here. It's great. And then from here, I'm going to come from the corner of the eye out. So we're finishing our grid. Starting at the hairline, watching her body language. Sometimes the clients won't tell you that it's hurting them, but it is. So we just watch the body language as we go in, getting closer and closer right into those crow's feet, right up into here. Now we're going to come out horizontally, and now we're going down the nose. I hold here at the glabella, holding the skin slightly taut, coming right down the tip of the nose, and then holding the nose to the side, coming down the sides of the nose, working in that nasal foci. This also helps to remove any microcomedones that may be in that area. And when you're working on the nose, she doesn't have a bulbous nose, so she doesn't have much on the tip of her nose. But some people have more of a bulbous nose. You can take the tool, come right around that bulb, and work around it, because a lot of people get a lot of microcomedones on that tip. So working all the way around on that tip area as well. So I need to finish your upper lip, so I'm going to have you put your lips in one more time. Coming from the center out. This is a very sensitive area. You can't create a grid here, it's too small of an area, so I just do my vertical lines. And a lot of clients like the neck done as well. Just be aware though, on the neck you can create striping or like little lines of hickeys coming down the neck. So I'm going to turn the vacuum down some on the machine. So now it's on a mild suction, and I have the client turn their head all the way to the side. That creates a little traction in that area, and we're going to come down the neck. Never come down with full suction on the neck. You're going to create hickeys on that neck if you do. Now she's going to feel a little bit wind burnt. If she sweats, it's going to burn a lot. So if she's going to be outside at all, make sure she wears a sunscreen. You can actually see on the tip of here some of the dead skin, but there's a filter inside here that collects a lot of it as well. So when you take this tip out, you can just throw that away. I like to rinse her face off now. Even though there's no crystals on her face, there's still a little bit of dead skin cells there. So we're going to rinse her face. Because we create a grid, vertical and horizontal, there might be some places on there that there's still like some dead skin. So I'm going to take some scrub, apply scrub on her face, and lightly manipulate. Remember, her skin is very sensitive right now. I don't want to over manipulate that skin. So I want to do this really lightly, so no pressure with my fingers. What's nice about this is the real fine exfoliation. Her skin's looking great with the scrub. I'm now going to rinse it off. After our scrub, now the face is clean. She feels wind burnt, and if you felt her face, I mean, it's just soft, soft, soft. So now we're going to nourish the skin. What's nice about this mask is that it has collagen in it, for one thing. It has sodium hyaluronate. Is that cool?
Yes.
Nice and cool. The hyaluronic acid is going to go in there and hydrate and plump up the skin. The arbutin helps with any pigmentation that's in there. And of course, collagen on the surface helps with moisturizing. Has vitamin C antioxidant in here. Okay, so we're going to actually leave this on her for 10 minutes. Okay. So now we're going to take off the mask. And you just peel that mask off. You can save it. The client could use it at home, maybe later on tonight if her skin starts to feel a little bit irritated. And you can actually massage this now into her skin if you wanted to. All of this is really good. It's got the collagen in there, the vitamin C, the hyaluronic acid for hydration, witch hazel to help close up the pores, but also calms down that redness in her skin. And now we're going to put the food. We're going to be using a little toner on her skin. And then we're going to use a moisturizer and then a sunscreen. It's really, really important. You don't let that client leave without putting sunscreen on their face. We always like to use at least SPF 30. Anytime you do any kind of exfoliation like this, you want that added protection. And you don't need a lot. Just a little bit, nice film all over the skin. How do you feel?
Fantastic.